Prime Minister Andrew Holness is warning Jamaicans that the country is at what he describes as a trigger line, and this is the closest it has ever been to going into lockdown since the COVID-19 pandemic shut down the country in March 2020. According to the Ministry of Health, based on the now 32.6% infection rates, 4 in every 10 Jamaican people are carrying the virus. He explained the severity of the situation during a virtual press conference on Monday.
Jamaica recorded its highest number of new COVID-19 cases over the weekend, 878 on Sunday, 527 cases on Saturday, and 723 new cases on Friday. Prime Minister Andrew Holness says the numbers show that the situation is serious.
This is very serious. We are now in the danger zone. And what is happening is that by virtue of our past success, by virtue of delaying this point for more than a year since the pandemic, there are those who believe that we have passed the worst. Yes, we are in the darkest hour of the pandemic. And yes, it will pass at some time. But exactly how that happens depends on how you, as an individual, as a citizen, as a worker, as a mother, father, you as the individual. It depends on what you do.
He notes the high number of people being hospitalized due to complications related to COVID-19. Mr. Holness says the availability of beds at hospitals remain a trigger line for the government's management of the pandemic.
In the early stages of the pandemic, we acted on the trigger of the number of cases. You would recall when we put up that trigger line, when we just started to do the controlled re-entry. You will recall that when we decided to put in some of the quarantine measures in communities, for example, in St. Thomas and in St. Mary, we looked at the positivity rate. Now we are at that very critical trigger line, and that is the number of beds. Because this trigger line is directly linked to the mortality rate. If people can't get treated in hospitals, and obviously if you have to go to the hospital, it is because you have dire symptoms, it is likely that you could have a fatal event as a result of the lack of hospital space. So your need to party and be free and go about not wearing your mask has to be balanced against the need of someone who will be deprived of care because we simply have no beds.
The Prime Minister says his administration has done all it can to safely steer the country through the pandemic, and it remains committed to saving lives with even more safety protocols.
If we do not get these numbers down, it is likely that the mortality rate could also rise. So, in this phase of the management of the pandemic, the government has to remain strident. It has to remain resolute in the measures that we have implemented. And I wish to prepare the Jamaican people that if the numbers do not improve, then, as I had said earlier, there are other measures which we will put in place. These measures will have an impact on the economy. It will have even greater impact on your ability to move it will have even greater impact on your ability to gather. It really depends on what you do at this point in time.
Prime Minister Holness, along with Minister of Health and Wellness Dr. Christopher Tufton and Minister of Foreign Affairs Kamina Johnson-Smith, were on hand to receive Jamaica's first tranche of COVID-19 vaccines on Monday. This first phase of vaccinations is being offered to frontline health workers, the security forces, and vulnerable groups.